Roy Culver loves to run, and he's good at it too. In 1997, he came within 4 seconds of beating the Alberta provincial record in the 3,000 meter. For his mother Camille, it's something of a miracle. Roy Culver's story begins here with another miracle, the miracle of birth. But for Roy and his mother Camille, it wasn't an easy beginning.
Roy was a real textbook pregnancy. Everything went fine, and this baby moved and moved and moved. And about a week before he was due, he just stopped moving.
Not long after Camille went into labor, complications set in. The baby became stuck.
I guess I was expecting them to say, well, we'll have to do a cesarean again. But they said, the baby's too far down. We can't do a cesarean now. And there were forceps were put in place. And I remember thinking, what is this doing to my baby's head?
Roy Culver's first experience with the world outside the womb had left its mark.
He was bruised, which you expect with forceps. What I didn't realize was that it had an effect on his jaw. It wasn't sitting in joint as it should be. It explained why he had trouble being understood. He didn't speak very clearly, so it made it just easier not to talk.
The physical effects of Roy's birth were obvious, but the emotional one became more apparent as he grew older.
Roy always, stood on the outside, assessed the situation, and was very cautious. It was always like he was never really sure he was going to be accepted. So, in a lot of ways, I do feel his birth had an effect on that. Well, his energy level was extremely low, especially as a toddler. It was really low because he didn't crawl, because he didn't have the energy to crawl. And then when we started with the gluten-free diet, he got up and started walking.
Camille set up an appointment to take Roy to see a craniosacral therapist. It didn't take long for her to know that she'd made the right decision. Carlene Daphne treated Roy as she does all her patients, with the gentle, healing touch of craniosacral therapy.
Because of the known trauma that Roy had, and because of the appearance of his face, and because of what I was able to tell when I put my hands on Roy's body, feeling for the craniosacral motion and the craniosacral rhythm, it was very clear that there was large areas of restriction in the connective tissue inside the head and in the rest of the body, the diaphragm. Roy was also quite bent over. He couldn't stand straight. The tissue inside his body was pulling him into this position.
The craniosacral therapist explained to us when she first had her hands on him that his diaphragm was all pulled up, and that's one of the first things she did through cranial was relax his diaphragm, and he just went, oh.
You don't really feel much. You sort of feel like there's just a hand resting there, and then sort of a bit of tension, then all of a sudden she'll sort of let go, and it will release, and you can actually feel your face sort of move.
He walked in the door after that first treatment. My husband looked at him and said, Roy, you're taller.
I noticed a profound difference in his facial features. It had really moved his jaw visibly, and it was remarkable.
At first glance, the human skull looks like a helmet, solid and immobile, a protective shell for the brain. When the bones of the skull are moving normally, cranial rhythm is balanced and we enjoy good health. When we suffer a trauma, injury, or are exposed to a toxin or even emotional shock, the normal motion of the skull can be affected, which alters the cranial rhythm. That, in turn, can affect other bodily functions. Roy's jaw and teeth had always been a problem. His lower jaw was overextended, and his upper and lower teeth didn't actually touch, which made eating very difficult.
When she put her hands in his mouth and did some craniosacral with his actual upper jaw, It was just amazing the color he had in his face. And I looked at him, and he had cheeks, whereas before they were sort of always sunken.
I noticed the first thing was when I got home and I had dinner, I never really knew it was hard for me to chew, but then I seemed to chew so much faster and so much better.
In the first month of treatment, Camille brought Roy to see Carlin 3 to 4 times a week. Camille watched as her son's condition improved dramatically, not only physically, but emotionally too. With proper nutrition and scheduled visits to the craniosacral therapist, Roy continued to improve, and he discovered a hidden talent. The boy who could barely crawl as a baby could run so well that he caught the eye of the track and field coach.
He was kind of pulled out of phys ed class because he had run well that day, and the teacher had said, well, run in the school track meet then, and Roy said, okay.
Camille and her husband watched from the sidelines as Roy raced in the 3,000 meters.
The gun goes off, and Roy runs out in front. And the people sitting beside me are saying, boy, Roy better slow down. I mean, he's got 6 laps to go.
It's difficult to run when you're with the rest of the crowd because they're passing and doing things. So I thought, if I can get ahead of these guys, I'll have a much easier time running. When I got ahead, I found it really easy just to keep going.
He just set his mind to, no, I want to win this race. I was really happy for him because it really paid, it was something that finally paid off all his hard work and self-discipline that he does on his own.
It's made a lot of things easier. I mean, there's the whole jaw thing. I mean, I'm a lot taller because of it. I probably would be 4 inches shorter.
His attitude is better. I think he's more positive, and I think he's overall healthier. I think it improved his health a great deal.
A few days after winning the race, he came home and said, everybody knows his name at school now. It was nice.
Coming up, from PMS to pregnancy, do-it-yourself remedies that put women's health care into their own hands. But first, exercise for the body, inside and out, next on Beyond Medicine.